All right, so that is, we just talked about the new natural law view and natural law, especially connected with Catholicism. Now, I want to move on to the ethics of care, which is especially connected to feminism. The natural law view is at least like at least 900 years old, and it can be traced back beyond Aquinas. The ethics of care is about 30 years old, so it's a much newer view, and it's an interesting view. I'm not sure it is going to be a lot more useful than any other moral view, but at least it's fresh. I mean, the people have been working on it fairly recently, so it has that going for it. All right, so the basic idea of the ethics of care is fairly simple and in some ways quite modest. It says that caring for others is a major and neglected part of human moral practice. And when we're thinking about morality, we need to address caring. So it's not necessarily making massive claims. It's not claiming that caring is everything there is to say about morality. And certainly people who are in favor of the ethics of care will definitely acknowledge that there are issues of justice, about fairness, which are separate from issues of caring. But they want to say that caring is a huge part of our moral lives, and we should pay a lot of attention to it. There is a big debate about whether or not caring is just about is a virtue. Definitely, it seems that being a caring person is a virtue. Is linked to other ideas of being kind and empathetic. But as we'll see, caring is more than just being kind to other people and being compassionate and kind of being a sweet person. Caring is especially thought about as a practice, as a part of a relationship. Now, there are questions about whether we have a duty to care for people. And that's a tricky question. I think that the one thing we would say is that we have our nearest and dearest, especially our families, and generally we believe we do have duties to care for our families. Especially parents have duties to care for their children. So we definitely want to kind of acknowledge that and think that it's an important idea, which, if you think about it, hasn't been emphasized by the utilitarians or the moral rules people or the dignity views, and you didn't even see it in the natural law view. So it seems pretty obvious that, you know, if you're going to talk about morality, one of the first things you want to say is that parents have an obligation to look after their children, and families have a duty to look after each other. And if I took a poll of people's views about morality, that might be one of the first things they say about morality. And all this other stuff about like making the world a better place, they may say, sure, that's great, but like that's not the heart of morality. The heart of morality is looking after your family. Yeah, and they might say like, well, yeah, lying is bad, but I mean, that's not necessarily the heart of morality. The heart of morality, again, is thinking about your most fundamental duties in life, and those are looking after your family. So people would say, yeah, you have a duty to that, duty to your family. Now, if you expand out of that and you think, well, what about your neighbors, your extended family? What about your town? What about your county? Do you have obligations to the people there? Should you be caring about your town, your neighborhood? And that might seem to be more optional. But I think a lot of people would say, yeah, I need to care about my town. And certainly my neighbors, you have a responsibility to your neighbors. So, and especially this idea of caring for them. We might want to talk about, well, what does it mean to care for your neighbors? And that's sort of interesting thing for Christians too. If you're a Christian, you'll be familiar with the idea that Jesus said the fundamental commandment, the number one commandment, is love your neighbor. What does that mean, love your neighbor? I mean, personally, I occasionally see my neighbors. Well, by my neighbors, I mean the people next door to me and the people over the street. And I know some of their names, but not all of them. But I don't really hang out with them much. Occasionally, I'll see them at some gatherings, but not very often. So, what do we, when we're thinking about neighbors and people around us, often we don't really think that our responsibilities to them are very fundamental. But I mean, there is this idea that we should actually be paying attention to those people. Okay. All right, so then we might want to think about, well, how about the United States of America? Do you have a responsibility to care for the United States of America? And many people would say, yeah, you do. Right? I mean, and some ways that fits in with the ethics of care pretty well. But I mean, if you're talking about trying to care for 330 million people, what does that mean? How do I do that? And it's a little bit, well, certainly it's going to be a lot different than caring for your kids. So exactly what does it mean? And then you might take one step back. How about caring for the human population? Is there a way in which we do have a duty to care for everybody on Earth? If we do, then I mean, that's a hard thing to work out. What's my responsibility to everybody on Earth? And some people might say, hell no, those people in Australia, those people in Europe, not my problem. They should look after themselves. But other people would say, I'm a global citizen and I need to care about the whole world. So it's a big issue. Okay. Now, to say a little bit about the origins of care ethics, it definitely came from feminist theory. There were claims in psychology that there was a difference between boys and girls, that boys were more focused on moral rules and issues of justice, and girls are more intuitive and they're more focused on personal relationships. I mean, we might plausibly say that girls spend more time talking to each other than boys. Often girls are pretty verbal. Whether that means that they're more focused on personal relationships, I'm not entirely sure. And whether it's really true that boys are more focused on moral rules and issues of justice than girls, I don't know if that's true too. But so people have made these generalizations about the differences between boys and girls. And I'm not, I think we need to be pretty careful about those. Even if there are differences between boys and girls, are they differences that result from socialization, or are they some kind of innate genetic disposition? I think we might be very tempted to say that's simply how boys and girls get socialized in Western culture. But and obviously that's sort of complicated now. These days we tend not to have very rigid differences in how we treat boys and girls, and we try to be more ready to for girls to be doing all the things that boys do. Again, views differ about that. Some people definitely do think there are central and powerful differences between boys and girls and men and women. Others don't. So there's big questions about whether there's different perspectives, that whether men and women understand the world in different ways. Now, feminists said girls both understand things differently, but also their moral reasoning is just as good as that of boys. It's just a different perspective. And so some of these feminists says there's a male moral view and a female moral view. And so this idea was that that women typically are engaged in caring. And I guess, I guess it's especially interesting with nursing because we think of nursing as a caring profession, and nursing is very much dominated in numbers by women. There are male nurses, but there are many more female nurses. And we might also think about like kindergarten teachers, which is a very caring profession, and maybe elementary school teachers, that's also a lot of caring. And again, that is dominated by women. So there is some temptation to say that women are drawn to caring professions, but then there may be very different explanations for why those professions are dominated by women. Certainly, if you do believe that women's perspective is different from that of men's, and that women's perspective has been left out of moral philosophy, then it's going to be very important to bring a women's perspective in. And certainly, if you look at the history of philosophy, all those great philosophers, Plato, Aristotle, Hobbes, Locke, Hume, Hegel, and so on, they're all basically white European guys. And you might think, well, so the whole history of philosophy has ignored and maybe even pushed away a female perspective, and now it's time to bring in a female perspective. All right, so the basic idea of the ethics of care is that it's an important part of moral life that we should care for each other. And we should understand morality as especially not just about respecting people or as following rules, but about caring for each other. And the idea is that this idea of caring is not something which is reducible to other forms of moral theory. So caring is not just about making the world a happier place or reducing pain. Caring is not just about following moral rules. Caring is not just about doing what's natural, and so on. Caring is its own independent way of living and thinking, and so we need to really pay attention to caring as a moral activity. The philosopher who has especially defended this view is Virginia Held, and she is a philosopher. She's emeritus now. She, for a long time, was active in New York at CUNY, at the Graduate Center in CUNY. Um, and yeah, as I've already mentioned Jesus once, and certainly uh, there's strong links between the idea of caring and loving. And it seems that Christian morality has emphasized the idea that we should love each other. I don't think that loving and caring are completely the same thing, but they are overlapping in some ways. I mean, nurses care for their patients. That doesn't necessarily mean that nurses love their patients. Although we might say that there is something kind of loving about caring for people, and so there's certainly an overlap between those ideas. So definitely we should be aware that there is a kind of part of Christianity which overlaps with this idea of caring, and we might want to be kind of careful about that, because on the whole, Christianity has not necessarily been the most feminist of views, and certainly Catholicism is very much dominated by men, and the Catholic Church is dominated by men. Maybe that's less true for other Christian religions. And I think a lot of people who believe in the ethics of care are very strongly devoted to feminism and women's equality. And so they're pretty reluctant to just kind of say, oh, our ethics of care can be folded into another view, and they want to hold it as a separate view. Here is a picture of Virginia Held, and she was born in 29. So she must be 93 now, right? Is that right? 97? Born in 29, yeah, 93, yeah, that's right. So she's definitely not doing a lot of work these days. She says that morality is not about independent, autonomous people. Rather, the idea is that people are in relationships and depend on each other. So we should stop seeing morality as just a matter of people autonomously behaving and acting. Rather, it's about relationships. And we should think about the emotional responses that are connected with caring. So sympathy, empathy, sensitivity, responsiveness are all required to be a moral person. And she would also say that anger can also be a necessary part of being a moral person. There are sometimes if you see something shocking or outrageous, it's right to be angry. And I guess one obvious example is if a parent sees somebody hurting their kid, the parent is going to be angry, and that anger seems the morally right response. So the ethics of care seems family relationships at the heart of morality, maybe especially the relationship between mothers and their kids. I mean, these days we want to say, oh, dads can be caring too, and dads engage in a lot of caring activities, and that's true. Although whether fathers are actually doing as much as mothers, I think that's a big question, and it may well be that fathers are not actually doing as much as mothers most of the time, although there are going to be exceptions to that. And one of the things that Held really wants to say is that caring is not just about your attitudes and emotions. Caring is an activity which involves a lot of work. So a mother or parent caring for kids is something which involves a lot of self-sacrifice and work, and nurses caring for their patients involves a lot of work. So caring is not just a matter of having the right attitudes, it's about doing the right thing and working hard. That needs to be kind of very much emphasized as being a big part of the ethics of care. All right, so as I mentioned, Virginia Held says that the ethics of care is a feminist ethics, and therefore it should keep its distance from all these other moral theories which have been very male dominated. She wants to say that justice is important, but you can't have justice without care. And if you're thinking about justice and care, you need to think very carefully about how they fit together. There can be caring attitudes towards people in other lands and total strangers. It's interesting, Held does actually explicitly support the morality of having a military for defense. So I mean, I think sometimes the ethics of care gets thought of as being this slightly hippy-dippy view that we should all love each other. No, she doesn't think that's everything about morality. There will be times where people have to defend themselves, and presumably, if you're thinking about maternal behavior, there are times when a mother will defend her kids by physical action, by being aggressive, and so it can clearly part of being ethics of care that people can be aggressive. So caring is not just about being nice and caring and thoughtful. It's about doing what's necessary, doing the work that's necessary to nurture the relationship. It's not clear what the ethics of care is going to say about factory farming, how it's going to be extended to a lot of the rest of society. Some people have argued that we should be caring about non-humans, but if you actually look at the literature, the ethics of care has tended to say very little about non-humans. So it's not very clear how it's going to be extended. I think should farming be caring? Should farmers care for their animals? Yeah, but does that mean farmers shouldn't kill their animals? It's not clear what we should say about that. So we need to be careful about that. I think what I'm particularly interested in, how should the ethics of care be extended to the issue of abortion? Because as I've said, the ethics of care has been very much linked to feminism, and feminism has tended to be very much about defending a woman's rights, and especially the rights to control her own body. And so feminism has been very much linked to the idea that women should have the right to abortion. So does that necessarily override all other considerations? And we might think, well, caring, having a caring attitude is not necessarily linked to doesn't really support the idea that sometimes a woman should kill her own fetus or get her fetus killed. And so we might want to puzzle, how does killing a fetus fit with a caring attitude? I think sort of interestingly, a lot of feminists, or a lot of ethics of care theorists have not really said a lot about that. So if the ethics of care supports abortion, we might also want to ask, well, if abortion is okay, then is infanticide okay? How do we decide that? And we might want to bring in issues of justice and say that when somebody's born, they have a right to life, and therefore they can't be killed. But it's not, it's a sort of open issue, so we're not really very clear what we want to say about that. What about the woman's attitude towards her fetus? I mean, these days, pregnant women tend to have a very caring attitude towards their fetus, if they are committed to having the baby. So they will do what's necessary to help their fetus thrive in the womb. They will often name their fetus, they will name the baby. They will also show their friends and family sonograms of the fetus and say that's their first baby pictures. So all of that is a setting of a practice of care. So it seems like caring is very important for women, for pregnant women, and is part of what we would think of as a caring attitude. So then we want to ask, well, what about a woman who doesn't want to be pregnant? Then what's the right attitude towards her fetus? And I think that's sort of an open question for the ethics of care. What should we say? There's been very little discussion in the literature about that. There is the work of Margaret Little, who is definitely a feminist theorist. And one of the things she wants to emphasize is the idea that she definitely thinks that abortion should be legal and the woman should have a right to abortion. But she also wants to acknowledge that abortion can mean a real loss for a woman. It's not an easy decision. And so a woman can have, maybe it's feasible to have a caring attitude towards your fetus and to recognize the value of your fetus, while at the same time still saying that it's not right for it's not the right time for a woman to be having a baby, and the circumstances mean that she doesn't want to have a baby and she should be able to make that decision. Margaret Little says that women may not want to take on the identity of a mother and they should have that choice.